Hello, everyone. Welcome to another live guest interview within Mindful Journey. I'm so excited to have you here with us today, and I'm delighted to bring you our guest, Dr. Jonathan Fisher. Dr. Fisher and I connected on LinkedIn maybe about 6 months or so ago. And for those of you who are on social media, highly recommend you follow his work. He puts out some great writings and what I like to believe is just raw and real and vulnerable content that is all geared toward improving self. And he shares personal stories and things relative to the world of medicine. But as I was just sharing with him before we started this conversation, he writes in such a way that isn't too granular in the medical realm if you're not immersed in it. He is an author, recently releasing the book Just One Heart. Absolutely amazing read. Highly recommend that. I'm not going to go into too much more of his bio, but just to highlight a few items that stood out to me relative to his personal life and story. He has mentioned, and I believe on his website and probably elsewhere in his writing, that he has worked with 20,000 hearts and healed in some aspects and treated in others before really taking care of his own. He brings about a humanization in this writing that talks about loss in his personal life and don't want to give away too much and to his level of comfort and willingness to share, may be willing to talk about some of that loss of a sister who had sadly passed. But what is again unique about Dr. Fisher's story to me is that he's not trying to be something that we so often see in our world today, where we want to have everything together, especially as someone immersed in the world of medicine. So he had a bout of struggling with depression, anxiety, just like many of us may be dealing with today on this call or have dealt with in the past or may in the future. With all that being said, Dr. Fisher, thank you so much for being here. Grateful for your invitation to join me and very much looking forward to our time spent together.
Thanks, Adam. It's great
Yes.
to be here.
Yes. Well, would you mind sharing a little bit? I failed to mention probably that you're still, for my knowledge at least, a practicing cardiologist. So would love to learn what got you into medicine and then what ultimately led you to the writing of Just One Heart.
I came into medicine just by growing up in a house where my dad was the town doctor in a small suburban New Jersey town. So he still lives there today. He's 98 years old, Hyman Fisher, and we have a big sycamore tree in front of the house where all seven of us grew up in. I have six brothers and sisters, and on that tree there was a shingle that had my dad's name, and people would park outside. This is before I was born, and they would walk into the first floor of our house, and there would be a receptionist there, and whatever was bothering them, he would take care of it. He did everything, and including making house calls. And one after another, my brothers and sisters fell in love with this idea of service to others, of health, biology, healing, and they all became physicians. And so I grew up at a kitchen table where people talked about these things, and it was like, what else is there that you can do? And so that's how I got into medicine. As far as how I ended up writing a book, well, that was about 26 years after I finished my medical training that I took the insights that I learned after practicing in what I saw was a pretty broken system that didn't give the best care to our patients. It certainly didn't seem to care very much about the doctors and the nurses that were doing the care. And I suffered a lot. And once I worked through my own suffering, I saw that I was definitely not alone. And we have a crisis in healthcare. And I wrote the book to see if I could speak to both patients, human beings, doctors, healthcare workers, and explain that we're all kind of struggling for the same reasons,
Mm,
though in different contexts. And the message is that we have just one heart, and what the human heart needs is pretty basic and pretty common. And when we don't meet those needs, we become sick in so many ways.
hmm So well said. And as somebody who's now read the book, I believe that you accomplish that objective wholeheartedly from a standpoint of a patient, right? Having gone through the system, unfortunately, I've not had anything challenging in my life that beyond just some traditional testing. I had a colonoscopy years ago just because some digestive things, but no major surgeries. And I know as somebody who operates as a patient, I have felt those experiences from the
Mm,
brokenness that you speak of, where I've sat with physicians, family medicine docs who you can tell they're kind of disinterested. And it would dawn on me that perhaps their perceivable disinterest as I'm seeing it is because of things they've got going on in their own life and having to look at the screen, right? And I know that's not fully probably what the brokenness that you're speaking of, but that leads me to a thought of how important it is it in your world, from your vantage point, to connect with the human and not get so bogged down with the technology, if you will, that's in front of you and can make your job better, but at the same time make it more challenging to connect. Well, maybe a better way of asking it is,
mm,
what have you done in your practice to ensure the human in front of
mm.
you is knowing that you care about them?
Yeah, it's a great point and it's a great question. And it's not the standard approach. It's easy to get caught up in the technology because of federal policy. We now are required to use computers in the office, in the exam room, even. And so what used to be a one-on-one human interaction when my dad was practicing is now there's three people in the room. There's the patient, the doctor, and the computer, electronic health records. And unless we're sensitive to the power that that computer has, we can become consumed by it. Those of us, who are on the doctor's side, we can focus so much on clicking boxes that are often required for billing and for coding purposes. We become secretaries. And so it's easy to lose sight of why we're actually there in the first place. I think this is
Mm,
what's driving a lot of the burnout and stress in healthcare is that those of us who took the oath to care for other beings did that because we did not want to be staring at a screen. We wanted to look into the eyes of another person and to help them heal, and in a way, to heal ourselves and as we do this
mm,
work. So once we recognize that this third party, this computer, is in the screen, it's not too difficult. What I do in my own practice, and when people ask me to help them improve their interaction, their empathy or perceived empathy, and human healing touch, the first thing is I call attention to the computer. You know, if it's just like a phone. If a phone is sitting out on a table when you're out to dinner, if you don't call attention or mention it, it can be there subconsciously, drawing our attention to it. Or we've got an
mm,
imagination and we're wondering, well, what's going on? Oh, what's going on inside of that phone? It's the same thing with the electronic medical record. So I'll simply, acknowledge to the patient that I'm with. I'll say, as you know, part of the requirements are I have to fill out some forms on the computer. Now, I'm going to try and do as much of that outside of this office as possible. Ideally, I wouldn't do any of it in the office, but with the amount of clerical workload we have to do, we just kind of have to do some of the work. And so I'll
mm,
call attention to it, number one. Number two, I never want it to seem like I'm looking at a screen that other people don't know what's happening on it. So what I'll do is I'll physically grab the computer screen and I'll turn
mhm,
it towards the patient that I'm with. So the two of us are now, we're not working in opposition to each other. We're sharing their medical record and we're creating it
mhm.
together. So
I
I'm
love
I'm
that.
more of a scribe. And so in a sense, what we're trying to do is we're trying to tell a story together, a story about their healing health journey. And I want them to be owners of the medical record. So I'll bring them over to that. That's one of the ways. And then the others have to do with how do we establish human connection, trust, and empathy in a very short period of time. And there have been books written about this and experts written about this. And this is the source of healing. From my perspective, this is why it's important. Now, if I
Yes.
was an FBI negotiator, it would be important because I need to know the truth and to solve the crime. But from a doctor's perspective, unless I can establish trust and empathy and some degree of mutuality very quickly, it's impossible to really do the healing work, and we end up being
Mhm,
technicians. And we
mm,
could go over a few dozen ways to establish empathy that I'm sure you and many people are familiar with, from establishing eye contact to a warm gesture to mirroring body
mhm,
posture to listening and mirroring the tonality of the voice and the prosody of speech and these kinds of things, and appropriate
mhm.
pauses, emotional intelligence work, these kinds of things.
Yes. Beautifully shared, and what a great technique. I took note here for my own self, just involving the patient. Again, in my world, somebody who's not a practicing physician, it just makes me think about like out to dinner, right? If I'm with my fiance and I have my phone there because I'm waiting on a call or I'm waiting on an email or something, just kind of involving her in the experience. I think that's applicable. Not I think, I know that's applicable for all of us, right? That what you're
Hmm.
saying, making somebody feel like, hey, we're together on this, and this isn't some foreign object that I'm working on without you. It's like, let me show you. I really love that. So thank you for sharing. You mentioned, you used the word technician, and you reference this in the book, how you went to medical school to learn all of this information of how to heal the physical heart, but you soon learned that there's more to a heart than just the technical skills, right? Or I guess healing a heart than just technical skills. Would you
Yeah.
mind sharing what you talk about in the book as it relates to the physical heart, emotional heart, social heart, spiritual heart? What does that mean, Dr. Fisher, and how important is it for us to take care of each of those pieces so that we can live better, happier, healthier lives?
I didn't learn this lesson from my patients. I learned it from myself and my own experience behind the scenes. So, though I'd be going to the clinic and talking to people about the chest pain they were having or the trouble breathing, irregular heart rhythms, history of heart attack, and I would be kind of a detective, very technical, very logical, very rational in approaching these things. There would be times when I would be called to an emergency situation where someone's heart was stopping, and as I'm walking down the hall, this is years ago, I would start feeling a tightness or a constriction in my own heart, in my chest,
Mm.
almost like panic or anxiety. And I didn't understand what was going on. I thought, well, I have a healthy heart. I'm not the one with the heart condition, and yet I can feel something going on. And so I started to think, how much of the heart's messages do we ignore
Mm.
in our own day-to-day life, and we kind of push them aside in order to do the work that we're called to do. So there was this emotional aspect of the heart, and then when my sister, and you mentioned this, my sister and my best friend Andrea died after a diagnosis of a brain tumor. The grief was unbearable. And that loss of the person who really had brought me to get help for myself and showed me that life was a lot more than just work, that social aspect of my heart was just broken, just broken. And so now I've got this emotional aspect where I'm dealing with anxiety and burnout. And then there's the social aspect where I lost the person that I loved the most, aside from my wife. And then beyond that, after being a doctor for 15 years, I felt like I didn't know why I was doing it anymore. I lost a sense of purpose and meaning. So, in a sense, my spiritual heart was disconnected. And by spiritual, I don't mean religious. I mean, my spirit, the thing that energizes us, that sense of transcendent purpose and meaning. And so, I started playing with this idea of the way we speak about hearts. And for thousands of years, hearts have been the center of poetry, of song, of literature, of movies. And there's a reason for that. From ancient times until modern times, we associate the heart with our physical core, the center of our vitality, but also it's where our deepest emotions are used to be thought to lie. And there's been this disconnection between the mind and the heart over the last 3,000 years. And I tried to write this book to capture the reunification, if you will, of these four dimensions of the heart, and to show some of the modern science that's demonstrating that there's actually no separation between what happens physically with our heartbeat and electrical system and circulation and the other dimensions of the heart, the emotional, the
Mm.
social, and the spiritual.
Mm. And when you dug into to kind of learn this, were you beyond your experiences, were you beginning to interview everyday folks in your community? Were you talking to your patients? And then if so, what was the common theme that you found that allowed you to kind of boldly come out and say, yeah, there is an interconnectedness between these four areas, and here's some proof, if you will, of like what has happened when X, Y, and Z
Mm.
and I guess ABCD, I should say, for a
Yeah.
sequence of four. What was the findings like that maybe patients had beyond your personal experience?
Yeah, there were really four lines of research that led me to the conclusions from the book. The first was my own experience, as I described, in terms of my emotional life, social and spiritual life. The second were those of my patients. Early on in my training, I started seeing patients coming in with all signs of heart attack, and their hearts were failing in the emergency room, and we couldn't figure out why because they didn't have the traditional blockage in their hearts. And there had been research for 20 years, something called stress cardiomyopathy or Takotsubo cardiomyopathy. Most people know it as broken heart syndrome, which initially we thought, well, this can't be true. Just for, well, many patients, one after another, who were having this condition. And I became very curious because we were clearly focusing on the wrong thing. If we were just focusing on traditional cholesterol and blockage, which is a common cause, the most common cause of heart attack, and we were missing the element of grief and stress and post-traumatic stress and depression, which were linked with this new type of syndrome. So that led me to read about all the different emotional conditions that were linked with heart disease. And I found out that many of these can, quote, break the heart. So I call these the heartbreakers.
Mhm.
And then on the flip side, I'm an optimist and I wanted to know if there were other emotions that could do the opposite. And I had studied the field of positive psychology as part of my own recovery from depression. And I found out that there's a constellation of emotions that do the exact opposite of breaking the heart. They can make the heart healthier, if you will. So line one of research were my own experience, two were my patients. Three, I interviewed 55 international experts in mind-body medicine, spirituality, cardiology, and I describe all the interviews in the book in different points. And then the four is I did an extensive literature search. I read thousands of articles, and there's about 300 citations in the back of the book where I go over the most recent research on how all of these things tie together.
Mhm. There was a story you shared in the book about the broken heart syndrome. A woman who I believe was in the care, she might have been in the ER, forgive me if I'm mistaken,
Mhm.
but all signs were pointing to a heart attack. And when you went in to treat her and began reviewing, um, her symptoms, etc., you found that digging into her personal life led you to this realization that she just lost a loved one. And in that moment, would you mind the listeners who've not read the book? I know we probably don't want to give too much away, but I think it's a fascinating
Yeah.
story. Just to talk about one that you being willing to dig deeper, take
Mm.
so many times we're surface level in life, all of us, where we don't take that one extra step, and then secondarily, in layman's terms, if you will, like what is broken heart syndrome? What's
Mhm.
happening physiologically?
Yeah. So this experience was very, very common, and doctors around the world know exactly what this is now, and it's so well documented and well researched. And what happened was a young woman who had no reason to have a heart attack came in with severe chest pain and she couldn't breathe. And her electrocardiogram, that little paper tracing that we do, showed signs of a massive blockage. Her blood tests showed that her heart was physically being damaged. And we put an ultrasound on her heart called an echo test, and we could see that her heart was getting weaker. And
Mhm.
all of these things suggested a blockage, but she didn't have any reason to have a blockage from cholesterol. And she was healthy. She was very fit. And I could tell also by her emotional demeanor that there was something else going on, which is when I asked her, I said, knowing that this condition exists, has anything very stressful happened to you lately? And that's when she shared with me that her daughter had been readmitted to a drug facility who had been struggling with addiction. And part of the follow up was to address that as well with mental health experts. And fortunately, her arteries were clean. We got her on medications to reduce the stress on her heart in that acute setting. And like so many people with this condition, her heart fully recovered. This broken
Mhm.
heart fully recovered within a matter of about 2 weeks. The question you asked is, how does this happen? And it's really interesting. And like anything in science, mechanisms are discovered over time. And often we discover something and we find out, well, it's not exactly that way. The current understanding is that we all have levels of adrenaline in our body. Adrenaline comes from the glands above the kidneys, and it helps us deal with stressful situations. Well, the heart has receptors, little molecules that sit on its surface that are ready to catch these adrenaline molecules so that the signal of high stress needs gets communicated to the heart so it beats faster and it can contract more strongly. Well, in this specific condition, there is both a surge of adrenaline because of the grief or the panic or the distress, and in the people who get this condition, there's an increased sensitivity of the heart itself to these molecules so that the heart has an exaggerated response, and the blood vessels themselves can constrict so tightly that the blood flow is cut off to the whole tip of the heart, and it doesn't leave the becomes weaker physically. It's almost like the heart becomes stunned because of the extreme release of stress chemicals. It's a storm of fight or flight chemicals.
Mm, fascinating. So if somebody is dealing with a broken heart, be it a divorce or just found out there was infidelity in a relationship, or if they've lost a loved one,
Mm.
what what remedies do you recommend without them having medication? Maybe they don't have access to, or they're not actively going to a
Mhm.
specialist. What can they do to ensure that it doesn't bring about that blockage that would end
Mhm.
up showing up on the in their testing?
Well, there's two pieces here. One, it's important to say that most people who experience the emotional stress that you're describing don't end up with this heart condition. And they have what's more traditionally a metaphorical, emotional broken heart, psychological broken heart. And we'll talk about that. With this other specific condition where there's chest pain, there's trouble breathing, sweating, anything that may possibly be a heart attack requires emergency medical attention. So I just want to be very clear that
Yeah.
I don't want to tell someone to go meditate when they're having a crisis. So
Sure, sure.
so with that being said, the second condition where it's a full-blown syndrome, at that point someone needs medical care. But if somebody is not having all of the symptoms and they're having more of an emotional breakup, they feel their heart aching and breaking. There's so many. Now we're talking about the psychology of how do we nurture ourselves, how do we comfort ourselves, and there are a lot of approaches. In my experience, uh, people can always benefit by seeing a mental health professional. So if there's ever a question about trauma, extreme grief reaction, depression, lack of interest in things we used to be interested in, always, always, always ask for help. It's always the right thing to do. Now, if it's someone who is is not quite in that situation, and they're able to do their day-to-day work, they're able to enjoy the normal things, but there's something lingering. If it's about grief, there's a whole way of working through grief, and grief doesn't have a timeline. It needs to be called out. It needs to be shared in a way. We have to share our story. We can write about it. We can share about it in our religious community or in our friend community. And ultimately, after working through the stages of grief, most people who work through it have found some way of making meaning of the grief itself, of the grief process,
Mhm.
bringing the core values, the essence of the person who passed or whatever was lost, and allowing that to inform your future actions and decisions and work, in a sense. It can give you your
Mhm.
life's meaning. Some people have found that a grief experience has changed the trajectory of their lives. So, I mean,
Mhm.
that would be grief. Other aspects of broken heart, I think at the root of all modern psychotherapy involves not doing what we tend to do, which is to feel shame, guilt, and self-criticism for having the feelings of anger, loss, embarrassment. So bringing self-compassion as a very first step in whatever we're going through, and then reaching out to a community, because there's nothing more effective in healing than having a support network. And
Mhm.
if we have one and if we're lucky, just to lean on the support and say, I don't know what I need right now, but I need you around me. And for those
Mhm.
people who are feeling truly alone, it's important to make friends with yourself.
Mhm. Mhm. The self-compassion piece resonates. In my own personal journey, I have been at times my own worst critic, right? I pride myself on being somebody who is a go-getter, if you will, not in the sense of like, hey, I'm going to work all day, 24 hours a day, but in a way that's, prideful, that if I'm going to start something, I'm going to see it through to fruition. And
Mm,
if I maybe fall short because I get, physically sick just with a common cold or something, I
mm,
can have that voice pop up that says, well, you have to fight through this, or, and what you're saying of self-compassion, I don't think it can be overstated, Dr. Fisher. And it's so
mm,
nice to hear from someone like yourself who is in a high-performing space. As doctors, our society points to you all as the ones who have it all together.
mm,
And it's so refreshing, encouraging, and also necessary to hear from people like you who are saying, give yourself grace.
mm,
My
mm,
question to you is, how? How do we give
mm,
ourselves grace when we're living in a
mm,
time where people feel like they need to keep up with the Joneses, where they need to have it all together all the time? And social
mm.
media, that could be a whole nother conversation of,
Yeah.
the detriment of social media,
Mm,
because we're only seeing a snippet of people's lives. But I'm getting it long-winded here. So let me
yeah.
just narrow back to the question of, how do we give ourselves grace to let go of our ego and say it's okay?
Yeah. The first step for me is to bring attention to the narrative or the story that we are believing that's driving us to feel so much pressure. That's driving us to feel so much pressure. So, for example, if you give the example of someone who's in business and they're hard driving and they're always feeling pressure to do more, and you have to keep up with the next person. It's always about keeping up, isn't it? Right? You gave the example of
Mm,
social media and social comparison, and comparison can be destructive. Well, it's the same thing in business. Young entrepreneurs, if you're watching other people and you want to compete, there is this toxic narrative that says that in order to be the most successful person in your life, you have to just work harder than everyone else. And I've seen
mhm,
this, and there's like we could point to people who are touting this as the ultimate truth. But if you look at wisdom traditions for millennia, no wisdom tradition ever said if you want to live a good life, you should work as hard as you can for as long as you can without taking rest and ignore the people that are important in your life. That's never been said.
mm,
And so to answer your question, the first step is really to ask ourselves, why do I feel so much pressure? Before I even offer
mhm,
myself grace, forget about grace for a minute, forget about self-compassion. Just pause and say, I'm working this hard. Who told me I had to do this?
mm,
And often, if we're being honest, we're telling ourselves that unless I keep up with others and I quote, win over others, I'm not good enough. And then,
mhm,
and then what we can do if we get curious is we can look at our childhood and look at our past, and we find that there were messages along the way, people who told us either out loud or by their approval or non-approval, that unless we continued to work hard nonstop and do better and better and better, essentially their love was conditional. And so,
mhm,
first piece is self-awareness. The second piece is bringing awareness to the inner narrative that you referenced, which is, am I yelling at myself? Am I forcing myself to do more? And what would it be like to ease up?
mhm,
And some people don't need to slow down. There's people who are very happy with where they are. They may be headed for a fall or not. It's very individual. But for people who are listening to this and maybe wondering, how do I give myself grace? How do I ease up a little bit? Just recognizing the pain that's there, and the
mhm,
restlessness that's there, and this constant running away from something, running
mhm,
away from bankruptcy, running away from loneliness, or running towards
mhm,
something, running towards things that are causing us to feel greedy and wanting more, whatever that is. Um, that pain point is a great place to start,
mhm,
and deciding, yeah, there's a better way to do this, and it starts with self-compassion and deciding to live a life with more balance.
mhm. Wow, lots to unpack there. Great advice. And to pull something out that resonated with me is just, beyond the self-awareness, really, you know, like, why am I doing this? Which is an element of self-awareness. And I think so many of us are are the way that we are because of our childhood, right? And I think you even referenced this in your book. All of your siblings became doctors, and I'm betting. Well, let me just ask you: do you think
Mm.
in your own life that part of your pursuit of practicing medicine was to make your dad proud, to make your mom proud?
Yeah,
Because I believe she was a physicist. Did you
yeah.
feel an obligation that you had to take that path, or they would not love you as much?
At some level, that was there at a very deep level. I wasn't aware of that belief at the time as a little kid. I was just wanting, I just always felt good when my mom and dad were like, "Way to go, Johnny! You got another A." We can all relate to that, right? Or like
Sure.
if you don't get that A, that feeling from your parents, that look like, "Oh, I don't quite approve of this." Well, wait, are you disapproving of my grade or are you disapproving of me? And there's that
Yeah.
confusion that tends to happen. I know in my own experience, on the downside, yeah, tremendous pressure, and life according to other people's expectations. On the upside, my brothers and sisters and parents served as an incredible group of role models to show me how much one person could contribute to helping others, and
Mm,
they drove me to do my best and to work the hardest. It's about finding that balance because you take that too far and suddenly you find yourself like I did, totally exhausted and burned out. And I realized that my parents aren't pushing me anymore. I'm pushing myself.
yeah. Yeah. Why do you think in the world of medicine I forgive me, I don't know the data or statistics, but I read an article years ago called Why Happy Doctors Die by Suicide.
Hmm.
And the woman who had done the research, she traveled beyond the United States, identified, I believe, about 1,000 physicians who had sadly completed suicide. And
Yeah.
the gentleman who she highlighted at the beginning of the article was an orthopedic surgeon, on paper was very successful. He was the orthopedic team doc for the Washington at the time Redskins and all the professional sports teams in that area. Yet he sadly left, dropped his kids off at school on a Monday morning and went home and hanged himself. And
Mm.
it hit me, right, like incredibly hard because again, even though not immersed in that world, the human life, there's so much value, and you're hearing about suicide rates rising
Mm.
amongst humanity, not just in
Yeah.
medicine. Let's first focus on, if you don't mind, on the medicine side.
Yeah.
Why do doctors seemingly take their life at more rapid rates than the
Mhm.
general population?
Well, there's a background to the story, and then there's the context of our current healthcare system and organizations. The background of the story is that not everyone chooses to become a doctor. It's a very self-selected group, and been a lot of studies on the psychology of who chooses to go into these fields, where you put yourself on the front lines of life and death in order to help save another person. And there's often a background of perfectionism, which is an impossible standard, which can create stress. A background of a martyr complex, where you want to sacrifice your own needs for the good of another, which, as we know, you sacrifice your own self-care, you become unhealthy, and that includes mental health as well. These are people who often tend to be loners, people who believe that they can accomplish great things by themselves and may not pay as much attention to family, friends, and community as people who are in other careers. And that social network is so important for our mental health when crisis strikes. So we have this group that's self-selected based on a number of psychological profile. And then you put them in a system where the culture is very damaging. The culture of medicine is kind of ancient. It's 100 years old in its modern form, and it's based around almost a military structure where there's this hierarchy. You have the attending physician, and then the fellow, and then the resident, and then the intern, and the medical student, and you know exactly where you are. And this hierarchy is so rigid that there's very little respect for individual autonomy, individual freedom,
Mm,
individual choice. And we know from the field of psychology that that sense of autonomy is essential for our well-being. And so from
hmm.
day one, it's kind of like stripped away from us. Number one. Number two, there's little attention to our own personal care. We're expected to sacrifice everything going into this field. And in a sense, there's judgment against you unless you sacrifice everything. And in a sense, there's almost this perverse kind of pride. Like used to hear people say, well, I'm on call in the hospital, not sleeping every fourth night. I work so hard, harder than anyone else. I'm dedicated. And someone else would say, well, I do that every third night. And someone else would say, well, I'm up all night every other night. Now,
Wow.
this is 10, 20 years ago. Nowadays, fortunately, the culture has changed. But Adam, you can imagine you take this group of people who have this psychological profile and you put them in a system that doesn't actually care about the well-being of the employees, generally speaking. And
Hmm.
it's a very toxic mix that can lead to a loss of sense of purpose, a disconnection from our patients, a disconnection from our social support, and a tremendous amount of shame and stigma against admitting to any mental health condition for fear that that's a sign of weakness, which, as you and I know, it's not. But within the
Hmm.
medical community, it's still seen that way.
Mm. My goodness, this is like a master class on leadership, on psychology, on so many things, Dr. Fisher. So
Mm.
many directions I want to take that because when you're talking about organizational culture, that's near and dear to my heart. Before rolling out Mindful Journey, I'd been in the trenches doing motivational speaking, leadership training, and I firmly believe and have plenty of examples to share of how when organizations make subtle shifts in what it is they call each other in the workplace,
Mm.
teammates versus employees, that can
Mm.
make a drastic difference in one's belief in self and how they show up. So when you're talking about culture change, that's a big one, and we're never going to be able to wrap our arms around it in the remaining 30 minutes or whatever we have left now. But I would love to hear from your vantage point some of the things that you've been doing within the culture where you're currently working, and how
Mhm.
that might be transferable to those not in medicine, for leaders who are on our call today who might be leading preparatory prep schools,
Mhm.
school districts, insurance companies. How can you take what it is that you've done, and because it seems like a little bit of reading I've done on your background that you're also leading some resiliency trainings
Mhm.
within your organization. What has that looked like, and how can we take that within other organizations outside of medicine?
I'm a clinical physician executive on a team called the Office of Wellbeing and Resiliency for a large multi-state healthcare system with 40,000 employees. And we help look after the well-being in terms of measuring it, many different metrics, physical health, mental health, social health, spiritual health, and also helping organizational change so that our clients get the best results, which those would be our patients, and more specifically, those that are giving the care are being looked after, which is not traditionally part of how we did things. And there's this nice movement that's afoot across industries in America and throughout the world, realizing that the way capitalism has operated for 100 years, 150 years, it cannot continue to operate that way. It can no longer just be about the bottom line, as Milton Friedman, a famous economist, said in the 80s. Ultimately, we're serving our shareholders in the bottom line. And nowadays, we know that we need to have compassion. We need to honor the individual's need for autonomy and purpose and connection. So, this old model of how work is done, unless we're ready to move beyond that, we're going to keep getting the same results. In our organization, we look after the stress points. So that could be on a unit level basis. So you go through the offices and you listen to the doctors and nurses and you hear what they're complaining about and you do something about it. Too much paperwork, too much clerical work, not enough support staff, whatever it is. And then on the other side, we give people skills that they didn't learn in medical school or even before that. Doctors are the most resilient people I've ever met, maybe aside from Green Beret commandos. uh, these are people who have put themselves in harm's way and also, go without sleep and spend years sacrificing themselves really to try to help preserve and prolong human life. And at the same time, there are skills that we don't learn. And we think that we're being resilient when we are just going through the motions and toughing it up. But I don't see resiliency that way. I don't see resiliency as just the ability to make it through a hard time. I see resiliency as going through a very challenging time while keeping your best foot forward by giving your best self in terms of your highest self, showing up with empathy, compassion, joy, love, and connection every day, even in the midst of that. That's the real challenge. That's what real resiliency is for me. And so we do everything from a half an hour uh, talks and programs to 3-day offsite leadership retreats where we do 10 hours a day of coaching for groups
Hmm.
of 20 leaders. And we look at our lives, we look at our inner narrative, and we look at our mindset. In terms of how some of these things can be spread outward to other places, I think about culture in 3 ways. And one of the experts in organizational culture, his name was Edgar Schein, and he talked about 3 levels of culture. And a leader who's leading a school or whatever they're leading, the first level is, what you see. When you look around, what are the messages? Are they messages about, clock in here and work as hard as you can, or are there messages showing that you actually care about the people that are there? Are you celebrating people's accomplishments and achievements? Are you
Yeah.
calling attention to the people who are doing the best possible job during hard circumstances? What kind do you use? Just like you referred to. So that would be kind of level one, would be the outward appearance, the artifacts. Level two would be, well, what are the behaviors of us as leaders? You know, do we do we close our door at the beginning of the day and then open it and go home at the end of the day, or is our door open? Are we walking around and talking to people and finding out how is it working here? How are you feeling? How's your home life? So this gets into how are we behaving? Are we behaving in a way that shows that we really care about the well-being of our employees, our team members, or are we behaving in a way that tells them all we just care about how much money and profit we're making? What messages
Mm.
are you sending? And then the deepest level of culture is work that really takes leadership development. It sometimes takes workshops and retreats. And that's, what are our core beliefs as leaders
Hmm.
and as an organization? What are
Yeah.
we believing about our mission in this world and in this organization? Are we trying to maximize profits, to beat our competitors? Yes. Are we also focused on enhancing the human experience for everybody who works here and making everybody feel valued, seen, understood, and loved? Well, those leaders who get to that deepest level and that deepest belief and approach, they have the most successful companies, and there's plenty of examples to show that. And
For
that's
sure.
what I go over in chapter 13 of the book, where I talk about living and leading with just one heart.
Yes. Yes, yeah. Going deep is, as I mentioned earlier on when I was asking you a question of how we often like stay on the surface level. It seems to be, to your point, those leaders who are willing to dive deeper and really help employees connect to their own mission and vision, that is of the organization, but then also their own, and how they can kind of intersect and marry the two together. It's certainly profound, and so grateful for you mentioning and sharing that. Going back to your book, you talk about opening your heart, and I kind of asked this question before of, like how do we give ourselves, permission to give grace and be a little less hard on ourselves.
Mhm.
But in this hardened world, Dr. Fisher, where
Mhm.
there can be a lot of division. You go on social media, it doesn't matter where you see somebody who believes this about politics and somebody believes this about politics, and then all of a sudden they're doing this with each other, be it verbally or
Mhm.
sadly in some cases physically. And I do believe that there are a lot of people, and I've seen friends of mine, and I'm certainly not off the hook on this, but I do believe that I've got more of a compassionate, empathetic heart, so I'm able to not allow difference of opinion to interfere with relationship. However, I say this isn't to pat me on the back. I say this to say that I've seen friends of mine who will be, they're so hard headed, like, no, I can't stand that person because of X, Y, or Z. What can we say to that person? What would you say to that person who wants to appear as though they're tough and don't have the courage to open their heart to love more compassionately, even when there's difference of opinion?
Adam, you hit on the main point here, which is that it's one thing to say, oh, we should all be open and empathic and compassionate and loving all the time. But you and I both know that that's not easy to do in a world that's divided. And we have conflict outside us, and we also, many of us have conflict inside of us. So it's a lot of work, and it's important work that we do to think about, well, how do I resolve the conflicts, first of all, that are inside of me? And we talked a little bit before about, well, what are the stories that my parents and early childhood authorities told me and taught me that I've internalized, that I'm carrying myself, that I'm not good enough, that I'm not worthy enough? And these are parts of the internal conflict and narrative that we have to do that inner work in order to show up as leaders. And then there's the outside world. Well, when we think about the outside world, we have to approach it with the wisdom of the ancient Stoics, who said, if I spend all of my energy trying to fight battles that I have no part in and I can't influence, I'm going to be wasting my time and making myself unhappy and
Mm,
not focusing on the things that matter. So we should focus on our circle of concern. To that person who wants to open up but isn't ready and feels closed off, for me, and this is just for me and many other people I've shared this with have found it helpful, there are these 7 qualities or traits of the heart that go back for thousands of years and cross all cultures. And every spiritual tradition has elements of these as kind of a stepwise approach to opening the heart. So, who's open your heart and trust everyone and listen to everything that's not realistic. And so the 7 traits of the heart for me are really a stepwise approach to opening the heart, connecting with others, and connecting with the universe in a sense, in the most spiritual sense. And these very quickly are, number 1 is steadiness. So we need to steady our hearts. Before we can open to the world, we have to be grounded ourselves. So there's practices here like mindfulness, like working with Stoic philosophy, cognitive behavioral therapy, all sorts of ways to steady our minds and bodies. The second is wisdom. Before we open our minds and hearts to everything, we have to be wise enough to know, well, what is true and what is not true? What is going to lead me towards more happiness and fulfillment, and what's going to lead me away from it? And we often get that wrong. The 3 is openness. So then we start to open our hearts and minds to ideas that we've never experienced before. And then 4 is wholeness. We start, before we can be fully connected with others, we have to bring back and integrate parts of our own personal history, the darker sides, as Carl Jung would have called it, the shadow sides of ourself that we don't admit to. We love judging other people, but often we're judging in others what is the darker parts of ourselves that we haven't fully
mm,
integrated. And
mhm,
so living with wholeheartedness leads us into the next step, which is courage. This person that you described that is afraid to open up their hearts, they've been hurt, let's say. Well, where does courage come from? Courage comes from the heart. It literally means heart. Cor in Latin means heart. Because for thousands of years, humans have known that courage comes from the heart itself. And then we don't want to have life that's serious all the time. It would be too heavy. So we need lightness. We need to bring that joy, that lightness, that laughter, that levity, all of these things into our day-to-day experience. This is where the field of positive psychology has done the heavy lifting already and shown us what practices lift our hearts and what practices make them heavy. And then
mhm,
ultimately, after we've gone through all of this, it doesn't take much time, then we get to the final and ultimate stage of living fully, which is warmth and living with a warm heart towards our own experiences and towards others.
mhm. Amazing, Dr. Fisher. Great, great. The 7 timeless. What do you call them again? The 7
7
tra
timeless traits of the heart.
of the heart. Okay, yes, beautiful. And again, for those of you on here with us, please check it out. He elaborates within just one heart. On a personal level, Dr. Fisher, one of the things I tried to bring about in these conversations is vulnerability. And I know you speak freely about your sister's experience, and I'm not being presumptuous that that's the most challenging thing you've gone through. But I do like to ask guests this one question, and it's been consistent amongst every guest we've had, and it's to your level of comfort. And the intention of this question is to, in fact, humanize this shared experience of life that we're on. Going back to social media, I do believe that we're living in a time where everyone is comparing themselves to everyone else. And it's easy to go on to a form of social media and say that my neighbor's got the perfect house, the perfect
Hmm.
car, the perfect body, the perfect partner, perfect spouse, perfect kids. Their kids are so well behaved and mine are not. And we just, the old adage of comparison is a thief of joy is so true from my
Hmm.
vantage point. But I think that when we hear from others who, from society's perspective, may have a mass success, and hear that they too face difficulties,
Mm,
that we inherently now can say, you know what? Oh, if Dr. Fisher went through it and made
mhm,
it, I can be okay to go through it and also make it. So that
mm,
leads me to the question of what is the most difficult thing that you've gone through in your life, and what
mm,
do you recall having done to get through it?
mm. Yeah, I wish I could say it was, fighting on the front lines of some battle where everybody was firing at me and I got the courage to go and hold the flag up and do something heroic like that. That wasn't it for me. The most challenging thing, the hardest thing for me, the scariest thing that I've ever done was to go to therapy for the first time, was to seek help for what was later diagnosed as anxiety and depression. And I say it was the hardest thing I've ever done because, for 25 years, I had grown up in a culture that said, we're strong, we're tough. In particular, men are strong, men are tough. Men can't have these types of things. It's a sign of weakness. There's something wrong with you. So I kept these things hidden from all of the people around me as I was going through medical school, going through training, getting into the best program in the country at Harvard. I worked my butt off to get there. And once I got there, I was so afraid that people would find out my truth, that they would know the real me, that I was a real imposter, I was a fake and a phony, that the fear that I experienced after my sister encouraged me to get help for all these things, the fear I had of just calling the doctor's office to make the appointment. I didn't want them to recognize me. To walking into their office, I literally was trying to hide myself with a trench coat in the Boston winter so that nobody would see my face walking into this office. That's the hardest thing I've ever done.
Mm, wow. Thank you so much for your vulnerability, for sharing. And I um, I could certainly imagine how difficult that would have been because to your point and to your used your word of imposter, I've certainly felt imposter syndrome. I think everyone I've talked to has felt imposter syndrome. But as somebody who's on the front lines of serving others, I can understand how in that moment you might have feared that your credentials will be taken away from you,
Hmm.
that you won't ever have patients again because you'll be viewed as incompetent because you're mentally not, well. So,
Hmm.
wow, Dr. Fisher, what an incredibly powerful story. I hope you're sharing that every day as you're able because it has the capacity to truly change people's lives. So, thank you for your vulnerability and kudos to you for having the courage to say, I'm going to go. I know your sister was influential, but what else? Was there
Hmm.
anything else that you can point to that you find? Maybe was it a motivational video? Was it a
Yeah.
piece of reading?
Yeah.
What finally got you to go?
Yeah, it was a combination of things. One, it was my parents gave me a very core belief, my dad and my mom, which is that no matter what challenge life brings to you, there's always a way to overcome it. And
Hmm.
I'm so grateful to them for teaching me that. I had no idea how much I would need that lesson in my darkest time. And so for me, I knew that some action had to eventually be taken and that I had to face my own fears. That was
Hmm.
one. The other was in community. I couldn't have done it without a really dear, dear friend who, at the time, there was a time when my sister was sick that this dear friend lost her own brother. He had died young, and she shared her grief with me and her grief journey with me, and I felt not alone anymore. And she shared some books and some inspiration, and the message was that when you feel like there's no end to your suffering, the next step is to just stop trying to run away from it and stop trying to cover over it and hide from it, and be willing to face your suffering head on. And for
Hmm.
me, that was a powerful lesson that I got from a very close friend.
Hmm. Powerful wisdom there for sure. To bring a little bit of lightheartedness to this conversation because I feel like we've gone so deep, and I know and I appreciate just you. What an amazing vibrancy you bring in your smile, and I can feel your authentic care. So thank you for that and for this because it's made some heavy topics, I think, easier to digest for some. But I do want to bring maybe a little humor to this.
Mm.
And so, what is something that maybe a joke amongst docs that you all say the general population as patients may laugh in knowing if we actually knew, like, what, give us something that
Well,
we might find interesting about your work.
there's a couple of really bad jokes. Some of them might upset some of my colleagues, but there's one that says, "What do you call the doctor who graduated last in medical school?"
I guess a doctor still, right?
Doctor. Yeah, you just call him doctor. That's a little secret, you know?
Yeah. I've always in the back of my mind, I've always feared that a little bit. I'm probably the pest to, and actually my doctor, my general practitioner, he's amazing. But I'm probably the guy who asks too many questions.
No such thing.
Okay. So there is I read, I'm a nerd for reading different books about medicine because I think that what you all do is fascinating from a standpoint of being able to heal, but secondarily that you all are human and you're expected to show up after maybe you have a fight with your spouse and now you have to
Mhm.
rush in to treat me. So Dr. Atul Gawande, who I think is a great writer, I think it was
Mhm.
Complications, his book Complications that I read, where he said that he I think his wife, if I'm not mistaken, was going in to give birth, and he didn't want the young doctor to be the one to treat even his
Mhm.
son. So what would you advise maybe a patient like myself who probably asks a lot of questions? What can we do
Mm.
to be relaxed so we are not worried about that young doc or somebody that we perceive doesn't care?
That's a great question. I mean, there's a couple of pieces. One, before even answering that, I would say what a good patient does is you trust yourself. You allow yourself to trust your own intuition. That, you're walking into a room, there's a quote, expert that's there, and it should be an expert. I say quote because in our minds we sometimes elevate other people beyond human status, and we have to realize that these are humans. They know a heck of a lot more than we do about certain things, but they don't know more about our own body and our own experience. So you
Mm,
as a patient, no one knows more about your own body and your own experience than you do, and so we
wow.
don't want to hand away our decision making, and we don't want to rush into any decision. So I would say in those situations, always trust your intuition. And if something doesn't feel right, if you feel pressured, if you feel uncertain, if you feel uncomfortable with the level of care that you're getting, it's well within your rights to say, here's what I'm feeling right now. How would you respond to this? And you may get a response from someone saying, you know what? That's the only doctor in town, so take it or leave it. Or
Yeah.
you may get someone to say, well, we understand this is a teaching university. We'd love it if this student can be involved or this junior doctor can be involved in your care. Would you be comfortable if I was more hands-on in the supervision, if we were here together? There's lots of solutions, but the key is to just voice your experience and voice your feelings about the situation. And then,
Hmm.
get curious and realize that you're talking to another human being.
Hmm. Great counsel. I want to be respectful of your time. I think I promised you an hour, so I see we've got 2 minutes left. I'd love to end on an inspiring note. And for listeners, particularly who may be going through something right now, we've tried to end
Mm.
in most conversations this way because it's not lost on me that amid all the wisdom that's out there, amid all of what you've offered us today, we are still dealing with human beings who are hurting. And sometimes I believe, information alone doesn't change situations. If it did, you might not have a job, right? Because if
Mhm.
people ate healthier, exercise more, and adhered to your guidance and
Mm.
what science has proven to be good for our hearts and for our bodies, etc., then everyone will be healthy. But
Mhm.
not, I'm generalizing now, but yet people still are hurting, right? Going through divorce,
Mhm.
financial difficulties. What's your message today, Dr. Fisher, to that person who's maybe listening in right now and they're like, wow, this was helpful, but you
Mm.
just don't know. I can't get off the couch. I'm just I don't feel any inspiration. that
Yeah.
person who's hurting today, what's your
Yeah.
message to them?
Yeah, that hurting often doesn't come from the pain of the experience itself. The hurting often comes because we're judging our current reaction as not good enough, as what other people might be doing in this situation, as not good enough because it's not the best version of yourself, that you feel stuck on the couch, that you, quote, should be stronger. You should be more capable of making it through this challenging situation. And so the advice there is to stop shoulding, stop comparing how things are to how you think they should be, and let the situation be as it is. However horrible, however painful, can you simply be with it without trying to rush it to be over? And sometimes realizing that pain doesn't have a timeline. Eventually,
Mm,
pain eases. And so often, and I see this in my clinic, that the pain continues and even gets worse, not because anything's changing about the situation, but because we're expecting it to go away quicker than it's able to. And so, this practice
mhm,
of accepting things as they are and bringing the most essential piece, which is what would you do if your friend was in the same situation? Would you yell at them and say, "You're not good enough, you lazy bum"?
mhm,
No, you would say, "No, you can't. I know you've been told you're not good enough in the past, but I love you in this situation and I'm here for you." And instead
mm,
of saying this to a friend, what if we could all learn to say that to ourselves in our deepest, darkest moments?
mhm. What a powerful way to close. I will end there unless there are any questions from guests who may still be on with us. Dr. Fisher, thank you so much. I am very, very much grateful for your time and inspiration you shared with us today and teachings. I look forward to and hope for our paths to cross in person in the future. I'll send you a note offline and with a link to this recording and such. But again, deeply grateful to you and thanks for the work that you're doing in the world.
I appreciate that, Adam. Likewise, and right back at you. Keep up the great work. Thank you.
Thank you. Thank you so much. Take care, everyone. Thank you, Dr. Fisher. Take care.
Bye.